Hey, so in the past few weeks, we have many care organizations streamline their onboarding flows. And so essentially, what we try to achieve with this onboarding flow is getting patients to fill in as much information as possible so we can have a effective consultation, but also obviously that they book that appointment. And so what we end up with is obviously a lot of things that happen, like an integration with Salesforce, an integration with EHR, which we all do. But part of it is also messages because we want to show personalized messages to the patients saying like, hey, this is what you still need to do, this is what's coming up. Now the problem is that with those messages is that we needed to find and craft messages that would resonate with dog lovers, with tech nerds, with Trek friends, and all in between. And this is difficult, and because it's difficult we end up with a very general message. And if you do that, you have patients that pour their hearts out, and sharing a lot of information, but then obviously only getting a generate message. And then I think the most personalization that we see in many organizations is like the hey first name, and then they think this is personalization. No, it's not, and your hey first name will not lead to any more engagement. So what we thought is okay, we have AI happening in the world, so why can't we create something that generates a message based with AI, based on input from the patient? So in this case, what you see here is the studio. We'll not go into details or of all the things that you see here. We have more videos on that on YouTube, or you can ping me on LinkedIn. But essentially, we have a generate message action where we need to explain to the AI what's the objective. So in this case, this is an onboarding flow. So you want to guide them and have them booked an appointment. And then we give them some personalized input. So we give them first name because, hey, first name is obviously cool. And then we also have a question where we ask like, hey, tell me more about yourself. And that's what we will also use. I know this UI here thing is very shitty, so we're working on that. So please ignore that. So what that would look like is I will show you that. We have here a link that I can click on as a patient. I want to sign up for your services. And then here we have a page. This is the first message, obviously not personalized because we don't know anything about the patient yet. So in this case, I want to be John today because I feel like it. I'm Renardo, and then I can tell you a bit more about myself. Sure do. So here I said that I'm feeling overwhelmed and that I like Shrek and that I want a therapist that understands my weird sense of humor. I now click on submit. What you will see here first is a very generic message because that's what we normally end up doing. So boom, almost there. In order to match your clinician, we like to know how your preferences. I'm like, dude, I just told you how I feel. Why are you doing this to me? And boom, this is the personalized message like hello John, first name Yuha, and then hopla, we ask like to find the right therapist who aligns with your needs and sense of humor. This is what personalization looks like much more, and this is just one example. You can obviously use that in other parts of the care flow as well. So just one demo, we have many more AI actions that are coming and already live, actually, like summarizing forms, summarizing care flows, summarizing or categorizing messages. So if you have any questions, feel free to reach out. And I think the end result of generating personalized messages is essentially this. So if you want to see your engagement through the roof, double down on personalization and maybe use AWL along the lines as well.